I have heard about the vampire procedure. Does that type of cosmetic procedure help with rejuvenation of skin? I am interested in, now that I am in my 40s, what type of procedures I could use to give my skin a youthful look. I have used Botox before, but only on my forehead. Can I use Botox around eyes and face?
Thank you for your question. You state in your question that you're turning 40 and that you've heard about the vampire procedure, and you're asking, does it help rejuvenate the skin? And in a related area, you've also mentioned that you have undergone Botox on your forehead only, but you want to know, can it be done for the eyes and face? So it's obvious that you've turned 40 and you are looking to do things to maintain your youthful appearance. Well, I can certainly give you some guidance with this question. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I am a member of the Vampire Facelift network of physicians. I've actually also been a resource for media regarding the Vampire Facelift. And of course, as far as the Botox question is concerned, I'm actually one of the early adopters and users of Botox, having been doing this for patients since 1993. So I can certainly give you first an understanding of what the vampire procedure is, so that you can understand what the benefit it has and where it fits in your overall quest for looking your best at any age. So to begin with, the vampire facelift procedure is derived from and was developed, a name developed by a colleague who basically created this very clever name that went quite viral, and is continuously, remarkably in the news for years. Basically, it's the fascination with the idea that conceptually has been around, but it took this name to actually make it literally become household, is that the idea is to use your own blood and to concentrate growth factors that are necessary for wound healing that stimulate your body's natural collagen blood supply. So what kind of effect does that have? Well, it improves the fatty cell layer under the skin. It improves the collagen in the skin. It improves the blood supply in the skin. And so when you treat somebody with this material, and it's called platelet-rich plasma, or PRP, in a couple of days to several weeks, the skin begins to have a nice glow. You look younger, you look healthier. Now, the specific vampire facelift procedure is a combination of PRP for skin quality and the use of a hyaluronic acid filler, such as Restylane or Juvederm. As you get past your mid-30s, you start to really experience some volume loss. And it's subtle. But because it's subtle, it's an opportunity to be conservative. And so my colleague Dr. Runnels, who developed this, basically conceptualized that start with just one syringe of a hyaluronic acid filler. Now, one syringe is not a lot. It's 1 milliliter. But when placed strategically for the right patient, not for the person who needs a lot more, but for the right patient, you can place it under the brow, the tail of the brow. You can place it in the tear trough. You can place it in the cheek. You can place it in the outer corner of the mouth. That's kind of typically where I place it. But generally, when people come to me for this type of procedure, I usually recommend more volume because they need more than that. But that's the idea. It's platelet-rich plasma with a hyaluronic acid filler, both working both independently as well as through your body's natural physiology in a synergistic way. It actually, hyaluronic acid and PRP actually work very well together to create long-term benefit as well. So I would certainly recommend highly the use of platelet-rich plasma. We use it in our practice a lot. We use it for skin rejuvenation. We use it for wrinkles. We use it for sun damage. We use it for fine lines. We use it for scars. We even use it in combination with a material called acellular matrix for hair loss. So we use platelet-rich plasma a lot. And in the tradition of many other countries outside of the United States, particularly in South America and in Asia, platelet-rich plasma is really very, very popular and highly effective. It's simply not had the awareness for physicians in the United States for many years, but I've been impressed by how it's eventually filtering into the mainstream of our aesthetic information. It's just that people don't always understand exactly the mechanism and how it works and why it works, but I can tell you as a practicing doctor that it really does work very well. It's about defining and understanding how it works and what to expect. It's not a replacement for fillers. Now, with that question, just to answer the question about Botox, yes, Botox can be used in multiple areas of the face. We most commonly use it around the crow's feet area, the lines around the eyes. We use it in the frown lines, what is often referred to as the number 11s, from frowning too much. It can be used to lift the outer corners of the lips. It can be used to create a little upturn of the lips. It really is remarkable how many ways you can use Botox. You can even use it to change the dynamics and the appearance of the nose. So there are definitely a lot of ways to use Botox. It's a neurotoxin. It prevents muscles from working, but when used in a specific way, it can do remarkable things to enhance your appearance. It's not by mistake that it's the #1 non-surgical procedure. So that with that being understood, I would recommend you look for a Vampire Facelift provider and explore your options and get a proper analysis and learn about the other things that you can also do to help you look your best. I really am quite a firm believer in maintenance, particularly when it comes to regeneration. One of the challenges for a surgeon, someone like myself who sees a patient who wants to have a facelift, is that when the tissue is thinner and it's more aged, you are dealing with less quality, which limits how much you can do as a surgeon. And a lot of times I would say you can also delay a lot of surgical procedures depending on your response to this type of regenerative medicine technology and other maintenance strategies. So I hope that was helpful. I wish you the best of luck, and thank you for your question.